We did our presentation on cognitive behavioral therapy. This therapy is a psychosocial intervention that focuses on changing unhelpful thoughts, beliefs, attitudes, and behaviors to improve emotional regulation and create a suite of coping strategies to help solve problematic issues. The history of this therapy. CBT was invented by Dr. Aaron T. Beck in the 1960s. So it all started with this guy right here who was a psychiatrist at the University of Pennsylvania. He was doing psychoanalysis when he discovered during his analytical session that his patients have an internal dialogue going on in their mind, almost as if they were talking to themselves. So this strategy of behavior is quick to help you identify and cope with challenges, and it helps you become more aware of your negative thinking. So if you're made aware of it, then you can help to change that thinking to hopefully make it more positive. And that is what this therapy focuses on, and what Aaron Beck was trying to focus on at this time. So how does this work? Cognitive behavioral therapy differs from many other types of psychotherapies because sessions have structure rather than the person talking freely about whatever comes to mind. And this kind of therapy also requires fewer sessions than most other therapies that a person might go to. At the beginning of the therapy, the client meets the therapist to describe specific problems and to set goals that they want to work towards. The client and therapist will together decide on the main topics they want to work on that current week. Then they will allow time for discussing the conclusions from the previous session. So a big part of this is you want to focus on what is bothering you the most, and not only do you want to do that, but you want to reflect on yourself and make sure that you are improving with every session. A lot of things that this helps with is depression, PTSD, eating disorders, just helping people focus on, what they are doing in their heads to help improve those negative thoughts. There are several ways to approach CBT depending on the issue the client is dealing with and their goals. Whatever the approach the therapist takes, it will include identifying specific problems or issues in your daily life, becoming aware of unproductive thought patterns and how they can impact your life. So these negative thought patterns will, eat people from the inside out if they do not focus on those and focus on bettering themselves. Identify negative thinking and reshaping it in a way that changes how you feel. Learning new behaviors and putting them into practice. And this is quick to help you identify and cope, and it's good alone, and it's also very helpful in other therapies. Thank you.